Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Justin. How are you doing today?
I'm doing all right, Dennis. How are you?
I'm doing well. Since it's the first time on the podcast, would you mind doing just a quick introduction of yourself?
Yeah. So I'm Justin Doroshenko. My day job is that of a senior emergency medicine resident physician at UT Health San Antonio. I am, long in the tooth when it comes to somebody who's in residency as a physician at this point, because I spent, 20 years working as outdoor educator, guide, wilderness medicine education, et cetera. And now, in addition to my working as an ear doctor, I also have several other roles with some companies providing some austere medicine education and programming from all over the country to some of the programs all over the world. So keeping busy.
Perfect. Yeah, absolutely. Just out of curiosity, I've never been to medical school, but I'm pretty sure it's not 20 years long into a residency. So what did you do before that?
Yeah, it sort of was a progression of just playing in the outdoors and then realizing that you could get paid to play outdoors and then really enjoying that and then learning how to teach outdoors. And so a lot of years as an outdoor educator, that brought me to, sort of EMS and wilderness medicine and started teaching wilderness medicine. And so would travel a lot doing that. So in various education guiding roles with, some other sort of, dirtbag jobs, crammed in between to, cover the rent. But it was a nice long journey from, practicing as a paramedic and teaching sort of layperson medicine and then moving on to medical school. And, here we are.
Yeah, here we are. And today's podcast, definitely, I'm going to lean into that education experience. And I think, generally you can kind of divide your students into two categories, right? You have your fairly beginning learners. They're just like, tell me what I need to know. I don't know anything. And I'll believe everything you say. And then you have the more experienced people that you kind of have to earn my trust and respect when it comes to whatever it is. So in what's super common in both of those groups is we love doing scenarios, right? We teach you the basics, the nuts and bolts, and then, okay, how do you put this stuff together? And what can make or break a good learning experience is the feedback and how you get to the feedback and how you present the feedback to that person, whether they shut down or they rise to the occasion, right? Mm-hmm. So that's, you mentioned you teach interns. So let's say brand new intern, bright and shiny, full of optimism. And, it's like their first kind of patient encounter. Like, how do you kind of organize feedback for them?
Yeah. And, to just want to like splice something there a little bit and, saying like beginning learners and, more advanced learners. There are some of the like educational schools of thought that like really kind of maybe folks have heard of this, but breaking things down on a spectrum of, the beginning learner, they both, they don't know what they don't know. Of course, everything is just a mystery. They haven't been shown the world. They haven't had a peek behind the curtain. And then there's a step. And then eventually you're shown these things and you all of a sudden, like, you're aware of what you don't know. It makes you a little bit safer, but makes you probably a little bit more scared and probably a little bit more vulnerable. And then you move on, then you like know what you know. And, you're kind of building towards that of like, everything is very conscious. I've got to draw every bit of information out. And then kind of moving on to that, like into some of the flow states, and it gets a little murky there of like, you are sort of like unaware sometimes of what you know, and you can just kind of like glide on it subconsciously. That tends to teeter into all of a sudden you don't know what you don't know anymore once you kind of get to a certain level. But I think it's really when you're kind of setting folks up for feedback, it's recognizing where they are in that spectrum. Do they have any clue about what's out there? So if we're talking about an emergency medicine intern on their first day, they don't know how to place orders. They don't know how to do any of the advanced procedures, anything like that. And so the feedback for them is tailored very much like towards the task. It's like, this is how you do this. And like, no. Take another minute on this step. We do the same thing like when we're introducing people into wilderness environments of like, they get out there and this is a whole different world and they don't know how to light a stove. They don't know how to tie a knot. And so the feedback is very tailored to the task and to that very specific moment. As you progress, like the feedback then starts to change and become a little bit more critical and analytical of like, they're aware of what they don't know now. And so they're striving towards that. And so it's a little bit more process oriented of like, okay, you know what you need to do next, but to get there, let's do these things instead. It's going to be a little bit smoother than this, like, assing around that you just did. And then it's more and more process oriented of helping people become more efficient and helping people just be aware, I guess, of where they are in crafting their own process. So, people, learn how to do patient assessment, right? And you learn it by the book, whether it's an EMT, paramedic, physician, whatever the level is, you learn it by the book and you do those steps. And you're having to think about it really hard each time. And then eventually those steps come naturally. But once you get past all the initial learning, you're developing your own style of doing things, the stuff that feels comfortable to you, using the memory aids that you feel comfortable with. And then all of a sudden, the feedback can be tailored to helping them refine their own process. And so it really is kind of like, we think about in pyramids of like, there's the rote information, and there's the replication of the information, and being able to sort of flow with the information, and eventually being able to teach the information. So it really changes along that spectrum. And so I really try to visualize it there of what is the learner even aware of right now? Because if they're not aware that they're going to have their own process down the line, I don't have any, need to give them feedback on that, portion of the topic.
Right. No, that makes sense. So how do you assess where they are? Because when you're a resident teaching, you're getting people constantly. Mm-hmm. People coming in, people leaving. Same as me, we get new students, every couple of weeks. How do you kind of, categorize them? Like, do you do an interview, or is it just in conversation starting that morning?
Yeah, and that's a really important tenet when it comes to feedback is, an awareness is the person who is the educator, who's the facilitator of just, knowing your audience and getting to know them a little bit ahead of time, or at least spending a couple of minutes. And one of the big pieces of feedback that I think regularly forget to do is to like actually ask the learner, what do you want feedback on? Like, what are you working on today? And if they don't have anything specific, that's fine. There are certain things that I can just like notice by watching them for a little bit of like, oh, okay, these are the things that I'm going to need to watch for here. But asking people for what kind of feedback they want is really important. Myself as, still a senior resident, so I'm still learning, and most people, will tell you it's not until you're out in like solo practice for several years that you really feel comfortable, and all being lifelong learners. But people on shift will ask me, like, what are you working on today? And usually these days, it's just, I'm just working on my pattern, my practice pattern, the way I want to do things, the way I want to document, the way I want to, manage a big emergency department. And if I tell somebody, a faculty member who I trust as an educator, and say, what are you working on? I have nothing specific today. I'm just going to kind of like go with the flow, and whatever you see, hit me with it.
Mm-hmm. Okay. All right. So, obviously before whatever learning event it is, spend a few minutes just asking them, like, what do you want to get out of this? Right. And at least the feedback I usually get is, I need to be refreshed. It's like, I only have a couple weeks, bud. Like, we kind of cover like all of medicine here. If you could narrow it down, that'd be super helpful. But I think it's a lot of like, I'm out of practice. We have a bunch of different jobs to do, and I don't even know all the things that I don't know anymore. And I have a limited period of time to spend with one individual. Getting them up to speed is not always the easiest, right? So, would you, even somebody who's experienced, right, quote unquote, is it easy to fall backwards and go backwards through that same curve?
Absolutely. And it kind of, you can almost look at it in a bit of a loop, because kind of as you get to the point where, you aren't having to think about the things, they just happen. All of a sudden, you're not really paying attention to what just passed by you. You just kind of rolled with it. And all of a sudden you find yourself out and you don't know what's in front of you. And then you're back at I don't know what I don't know, because I'm just in an unfamiliar environment at this point. I can't teach and prepare for every single, possible scenario that could come up. And so eventually you find yourself out on the ledge there. And I think when you read stories about big accidents in like high mountain environments, or, when a rescue doesn't go well or something like that, I think a lot of that can be attributed to folks losing whether it's humility or just kind of some of the self-awareness of, I don't know everything, and therefore I need to be careful as I'm approaching this. And so I think it just takes a conscientious effort when you're in situations where you might have to apply this, and also recognizing that in the education, the teaching environments of, I might be watching this person, completely run into a roadblock. And then also, again, having an awareness of where they are on that sort of spectrum of learners of, are they going to hit this roadblock and then they're just going to completely shut down? They don't know how to process. They just know task, 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 and nothing else you can do. Or are they somebody who is process oriented and they can try and like maybe, worm the way around something and kind of let them flail a little bit?
Yeah. So I imagine like your beginning learners, right? You don't really want them to flail too much. Maybe enough to get like a bead of sweat, get started. And then, okay, we start, ping-ponging them down the alley of like, this is the right thing to do. Mm-hmm. More experienced people, I love seeing them sweat. Because then they get kind of desperate, and then they start paying attention to whatever I have to say, and it makes me feel good. So, again, I mean, I think education is kind of a tightrope. You can do the right thing too much and you still lose. When you're giving feedback to whomever it is, like how do you kind of walk that line to find out, like, I'm correcting this person? Are they paying attention? They taking the information in, or are they, feeling criticized and now we're shutting down? Does that make sense?
It does. Yeah. And I think the best way to look at that, and a way to allow that to happen without damaging somebody or making somebody feel ostracized or, just like an idiot, is framing it ahead of time. And so setting up the parameters for like, this is how we're going to give feedback. This is what I'm going to do. And it's going to happen at these time points. It's going to be in this format, and just letting them know, especially in an educational environment, that like it's safe there, and creating safety. I mean, you can create safety and then still create a very unsafe feeling, setting, whether it's in a lane or a scenario or something along those lines. But when it comes back to the end or stopping point or wherever it is to give the feedback, they've already had this primer that it's okay for me to have screwed this up. It is a safe space. and I also have some sense of what's coming. You know, one of my favorite stories to tell when it comes to feedback and this kind of like unexpected onslaught was when I was actually in graduate school. I went to graduate school for outdoor education, and we did a lot of the rest of the master's students, and we would go off on expeditions, and we would be leaders during the day and things like that. And I had one, she was a wonderful professor. She was the department chair. She was very much a character, and just bold, full of life, very energetic. And we had a long day, and it was my turn to receive feedback. And we're sitting underneath a tarp. I think we were somewhere in like northern Alabama. And the feedback for me, it started off in the way that it had been kind of set up as, we can give you feedback on these things. And then she just launched into this like 20 to 30 minute diatribe, or I don't really know what it was, because I think I probably blacked out a few minutes into it, and just nobody's ready for this. My classmates, I mean, it's a small group, and my classmates were all just kind of watching this. And after it was over, one of them came up to me and she said, "Are you okay?" And I was like, "What do you mean?" She goes, "Well, you were just like deer in headlights the entire time." She was like, "You had no idea what's coming to you." And that's like my very visceral memory, even though it's from, 15 plus years ago, that you got to have at least some readiness for what's coming to you when it comes to feedback, because you can really cause somebody to shut down if they don't know what's coming. And then I find that if the feedback that I need to give goes outside of those parameters, and I realize through a course or a scenario or a program or whatever it is, that it's going to fall outside those parameters, that I provide that feedback at another time, ideally, where I can take them aside, restructure the primer and the setting and the expectations to be able to deliver that, rather than blindsiding them with something they're not expecting. And depending on how you frame that experience, it still gives you a lot of latitude. I mean, the styles of giving feedback are as varied as possible, and you can ask, a dozen different educators the best way to give feedback. You're going to get, 38 different responses. So I think it's really about setting expectations, no matter what your approach is going to be.
Okay. Expectations being, I'm going to give you a compliment sandwich. I'm going to say, "You dressed well for today. You killed your patient. But you took it really well."
Yeah.
So, is that what you mean, kind of format wise, or?
Yeah, I think it's both format and again, this depends on, are these early learners who don't know what they don't know, and so that I'm not going to spend a lot of time course correcting them. I'm just going to say, "Hey, instead of this, do this." Right, but letting them know that I'm gonna point out things that you did wrong. I'm also going to point out some things that you did right. I'm not going to point out all of the things on either side, but I'm going to try and draw out a few different things, and letting them know I'm not going to give you 68 things that you did wrong. I'm going to pick 3 or something like that. And whether it's the compliment sandwich or other, colorful ways of describing that, or, all self-feedback of like, you tell me the things that went well, or the, peer input as well, and like asking people in the group to give feedback. It really depends. And of course, like, depends on the audience and the age and the setting, and, what's the expectation, part of, I think what got us connected, through my work with specialized medical standards and the osteo emergency care course. And, when Dr. Sean Keenan asked me to create this instructor development course for our instructors because they wanted quality control, and, I created the course with that approach in mind of, I'm going to tell you what you did wrong, or what I think you did wrong based on my experience. I'm going to tell you those things, and you might not be used to getting that from somebody. We did an abridged version of the course at last year's SOMA conference in Raleigh, and a lot of the students, they're experienced physicians and surgeons and medics been doing and even teaching for many years. And that's intentional in the folks that we want teaching on the AEC course. Like, we want experienced educators, but we want also to bring those educators in and make them get feedback. And we let them know at the beginning, you're probably going to get told things that you've never heard, that you don't agree with, because you were never in an environment where it was possible, and you were never set up to receive that feedback properly. Maybe somebody told you that, but you weren't ready to hear it, and therefore it just underpassed, whatever. So, the format is almost, give or take. You can use any number of them as long as people know what's coming towards them.
As long as it's, I imagine, fairly consistent, right?
Mm-hmm.
And it's funny you mentioned, hey, we have experienced providers, we have experienced surgeons, we have experienced medics. But I will say, just on my time on this earth, having an experienced person in a given field or a given expertise does not necessarily make them good teachers to other people.
Absolutely.
Some people, they're awful.
Yeah. I mean, and this is the problem that folks in my line of work, and the people that I run with and talk to, both involved in SMS and other areas, is people tend to become instructors and educators because they've been there for a while. I was never in the military, but I work with a lot of military folks and operators and things like that through SMS. And I've learned that oftentimes in the military, that you are just promoted to instructor because you've been there. And so you've been doing this more than anybody else. Now you're teaching it. And the same thing happens in a lot of medical education of, failing upwards, if you will. And, even, the sort of letterbox courses that we all have to take for, all the little acronyms after our name, the education that is provided to their educators is basically nothing. You're given a textbook and said, teach from this. And, it's not the way to create good, strong educational experiences for people. That's obviously my opinion, but the whole point of things like instructor development courses and, instructor trainings and all the other areas that I get really excited about is I get to show people that there's another way of doing this, even if they've been told for 20 years, you're the teacher, you're the expert. You get them in front, you set them up for what they're going to have. And, they're almost always great results. I mean, every once in a while, somebody's kind of stubborn and stands up to it. But, for the most part, people are open and willing to hear things about themselves to make themselves better if they're coming for altruistic reasons. Now, I work with very, voluntary audiences. So people are coming to the courses because they want these things. And so it can be a little bit different with, captive audiences and things like that. But it's, the most people that have been teaching, educating, instructing, facilitating for years and years, at some point, there's nobody around that can really give them feedback anymore. They're at the top and maybe people are afraid to give them feedback because they're oh, this is the person who's been doing this for a long time, person up on the shrine. And so bringing people into an environment, of course, they want to come where somebody who, I may not have as much medical knowledge as a lot of these folks, but I know education and I know how to develop instructors. And you set that as part of the parameters of, I'm not here to teach you how to be a better surgeon. I'm not a surgeon. So no, but I can teach you how to be a better educator, because that's just kind of universal if you know the things to look for.
I think some things can definitely be taught about teaching. And I think some things are just kind of inherent to just being another human being and recognizing this, student wants, something from me, whether that be just knowledge, whether that be just a different experience and somebody to watch and give some kind of feedback, because maybe they never get it because there's nobody else around them that's willing to tell them anything. So,
Yep. Yes, exactly.
you know what I mean? So it's just like, please just critique me just so somebody can give me feedback. You know what I mean? Yeah, I think it's very much a very human thing to do, what we do, in that I'm really just talking to you. I'm going to tell you what I saw. If it jives with what you kind of already have in your mind or already have questions about, then we can match up. Then we can actually communicate, and I can help you, rise up, hopefully.
Yeah, one of the metaphor that was shared with me a long time ago about feedback was that it's a gift. Like somebody gives it to you, and just like with a Christmas present or birthday present, like you open it up and you kind of like in front of the person, you look at it and you just like smile and you say thanks, and it may be something that you never talk about again. It goes home with you and then ends up at Goodwill. Or it's something where you then ask them questions about it. They're like, tell me, why did you buy this for me? Or you go back to them regularly and say like, oh my gosh, this present was amazing. And so it can go any of those directions. You never know what's going to resonate with the person. And, there's just a lot of things that you can do with that feedback. I've gotten lots of feedback where it gets told me and I go, I'm not changing that. Like that's who I am. And that's part of my style. And I get what you're saying, but I'm not changing that. And, for better or for worse, like I admit that. But yeah,
but that's the other side of being just another human being, is like, we have our own egos. We have our own, things about us. And, we have to balance that, when communicating with another learner. They don't take our feedback. Like, does that hurt your feelings? Like, are you gonna now, just critique the crap out of this person and point out only the bad things they've ever done and never any of the even kind of positive things that they do, just because you're mad at them? Or are you going to kind of get over yourself and understand that they're just having another reaction?
Yeah.
And maybe they don't want to listen to it right now, but it's still there. And I'm pretty confident they're debating it, just not right now.
Yeah, it always makes me think of this, the scene from the Goonies when Chunk gets captured, and one of the brothers says to him, like, tell me the bad thing that you did or the bad things that you've done. And he meant like in that span of like an hour, and Chunk starts at the beginning of his life and starts telling literally every bad thing he's ever done in his entire life. And I think that's what, especially some like both new and old learners, you start mentioning a couple of things and then they get in their head and they're going, they're going to point out every single thing that I have ever done wrong in teaching. And they just panic and they shut down. And it comes back to the framing part of things of like, I've got to set them up and let them know that's not going to happen. So don't freak out. You may freak out in your mind a little bit, and may hurt your feeling a little bit, but they know what's coming at least.
So I guess maybe I have a specific kind of, I don't know, I guess it's not that specific, but let's say somebody's going to do a procedure. They're going to do like a advanced airway. It happens, right? Whether it's good or bad, it's somewhere in the middle. Like it's going to be one of those. I guess to me, I'm more concerned about why did you even choose to do this, versus necessarily the technique. As long as it ended up successful, whether that could be fast or slow, like, yeah, we could polish that up. Hey, you forgot your securing device over there and you probably should bring it over. Something like that. I think those things are fairly obvious and they recognize like, oh yeah, I should have done that, but I didn't. I will next time. But like the deeper kind of stuff of like, what was your indication? Like, why did you do this to begin with? And that when I ask things like that, people kind of assume like, the worst. Like I shouldn't have done that. And I will, in that situation, I will never do that again. When I'm really just asking, like, what was your thought process? I guess, how can I do this better to get what I want?
Yeah, I think in moments like that, I'm just trying to think of like specific situations where I have been, I think exactly what you're describing. I think one of the best ways to handle that, especially if you know that they've reacted that way in the past, or you're kind of like feeling that might happen, is to, it's more than about facilitating the evaluation rather than telling them the evaluation. Of like, let them try to get there, and you like throw in little clues. And if they say it, like so many times with me as a learner, as an educator, all of a sudden you say something and it's just like, oh, like I just needed to hear it come out of my mouth. I just needed the thought to come from that spot of my brain and come flying out. And so I think if you can, especially those process oriented questions, let people discover on their own, and and honestly, like intentionally doing that too. Before we started recording, you and I were talking about the concept of training to failure. Of I'm going to create situations where you are going to get stuck and you are going to fail at something. Your simulated patient's going to die. You're not going to get this airway. Whatever it is, that it's only when we reach those points and we get lost in the process, or we don't know how to answer a question, that you really start to think about it analytically, as long as you have the base knowledge there. Obviously, you don't want to get somebody there too fast, but getting them to, like, pushing them to failure, this, is a huge problem in medical education, just writ large, of you do a simulation and you finish the simulation. Like the end point is you save the patient. Or if you do something catastrophic and the patient dies, and we kind of make it like a joke, or, hit a little buzzer or something like that. And instead, like, making it intentional that you are going to fail at this. You are going to hit an endpoint no matter what you do. And it's really about how you process that we can give you feedback that you should feel confident about your process. You should feel confident about the way you went through these things, even though you were going to fail regardless of what you did. And so in that situation you're kind of describing, like, I could imagine a learner getting to that sort of like quasi fail point, and they don't really know what to do. And then you facilitate them going back to that experience to kind of walk themselves through of how they got there, rather than telling them like, you did this wrong. And I'm not saying it would ever be that, direct and forceful, but self-discovery is important.
Yeah. No, I usually see, because we do a lot of trauma type scenarios, and it's very fast and it's very dynamic. And I think people get very used to, I'm just doing stuff. And you know what I mean? Like, he's got penetrating chest injuries. All right, we have IV access. He gets blood, bilateral needle decompression into finger thoracotomy, into chest tube. Like, and I think most people, probably in whatever scenarios they had before, everybody was like, yep, that's the right thing to do. And I'm asking, well, you never put like a pulse ox on him. You never took his blood pressure. You felt his pulse, which is something, but how did you get from his pulse is rapid to a unit of blood and, bilateral needle decompressions into finger thoracotomy, into chest tube? Like, how did we make that leap? And I find that people are like, "Meh." Like, and then maybe the next line, like, they hardly do anything. So
yeah, and I think it can, especially somebody who is in a vulnerable place, like, failing in an educational endeavor, then all of a sudden just telling them everything that they did wrong, is piling on the defeat for them, instead of, and again, like you set it up at the beginning of, like, okay, tell me the things that you did well that to get to this point, and then tell me 3 very specific, like, choke points or dilemmas or decisions you had to make. And so reframing it as, instead of saying something you did wrong, like, let's talk about the point when you hit a stopping point. Like, what was the dilemma? Yeah, maybe you made the wrong choice, took the wrong path, but let's talk about the dilemma and the thought process that goes in there, so that we're not focusing on what you did wrong. We're focusing on the thought process that got you there. And I think that can be that's really beneficial for them to then all of a sudden they're empowered. They know the process, and they're like, oh, so yeah, I did that this time. That was stupid, but I now understand why I should be going this way instead. And the whole, the concept of failure is finding those boundaries, is finding the blind spots. And it's not until you get a learner to kind of like stop and dwell on that moment and really look around that they actually see all those blind spots.
I think it's super helpful to almost get a learner almost stuck, to the point where they're like, okay, I finally found the edge of what I know.
Mm-hmm.
Now, patients, they don't care what you know or don't know. The pathology will continue regardless. And I think it's super helpful for a bunch of reasons. One, okay, we've found the edge of what you know in this aspect. I can take you further, but also being able to recognize, hey, I've kind of run out of road. I need to reach out to somebody else. Because in our course, when I was a student, at no point in time was it ever okay to not know the answer.
Mm-hmm.
And that's why we have a very high attrition rate, because all those people didn't know. And I at least pretended well enough that I did know. So, obviously that's not realistic. That's not sustainable, that a given person knows everything about everything in every situation and at no point ever needs to ask a question, right? That's just nobody, I don't think anybody in medicine operates like that. It's just all-knowing, entity that everybody else gets advice from.
There are some that do it, but they try. Yeah, they try.
Successfully?
No, not at all.
Yeah.
See right through it.
Yeah.
No, and like that, that point that I think we're both talking about of where they reach that and are able to process that moment, then it gives them a little bit of insight that maybe some other time in even in real life, they encounter a dilemma somewhat similar to that one, and they at least have a little bit of something to draw on. This the whole how do you teach judgment? How do you teach things it's creating situations where you have to think through, and then you're putting pieces together. You get somewhere the pieces aren't quite the same, but you're able to put them together a little bit more. I have my favorite example of this. I can't remember the name of the school, but it's a Swiftwater and Whitewater school somewhere up in Canada, I'm pretty sure. And they would create a simulated environment where your life jacket is snagged by a strainer or something underwater, to where you're actually pinned and have to get out of your life jacket and swim away, which is a very, very, very rare circumstance, but you got to be able to do it. And so they set up safety downriver, and they, bring the learner out, and they stick the, T-grip of a canoe paddle back in their lapel, and they just pin them on the bottom of the river, and just kind of it's safe. You can bring them up at any time, and then it's that rare circumstance where that does happen, where you actually have to be able to pull this off in a matter of seconds, potentially. You at least have something to draw on, and some sort of memory of, maybe it just gets rid of that. And, the initial panic's always going to be there. It's terrifying, but that secondary panic goes away, or you just have a little bit more clarity in that moment. One of the folks, when I gave a presentation on training to failure a couple of years ago at a conference, and one of the folks that I talked to get information about that was one of my faculty members at the hospital, who was a Navy SEAL, and talking about Hell Week for SEAL training. which the whole point of that is to literally push them to the edge and push them to failure at every single obstacle, so that rite of passage and survival and all those kinds of things, but also to like help people learn where their limits are. And, and that it goes back to the, that first thing we were talking about of like having some self-awareness of what your limits are, what you don't know, even when you have all this experience, and, not developing, the ego that we were talking about. That's not sustainable. There has to be some ego. Otherwise you're not gonna, you're not going to have high performance without an ego, but, have it be a layered ego.
Sure. Of course. And I think, it's a lot more difficult to teach somebody how to think rather than just what to think. What to think is super easy. Like, look, it says right there in the book. That's what you think. How to get to those processes, how to take all this knowledge that you have and piece it together to get the best outcome is a lot more difficult. And it's hard to do, I think, without pushing somebody to that edge.
Yeah, it's that pyramid of, at the base, foundational knowledge of just stuff, just the stuff, the materials that you're going to build with. And then it's like, okay, I've got the stuff and now I kind of remember what it is and I can point it out pretty easily. And then now I know to use this stuff. And then like just becoming more and more process and flow and less task oriented is, I think it's something that comes very easily to folks that work and teach and learn in the environments that we do, because like inherently we know that there's going to be failure. I mean, that's kind of the point for doing a lot of, in the outdoors, or, whether it's, some sort of, law enforcement or military capacity or something that just gets you in an austere environment, almost by definition that there are going to be times when you do not succeed because you cannot plan for all these, different contingencies and different possibilities. And so I think it's something that like luckily comes fairly natural once you introduce somebody to that topic. They can be the, hardest, most, grizzled 18 Delta on earth, but they're also like fully aware that they have encountered things where they just didn't know what to do. And, you ask for help or you figure it out, or like maybe there's a bad outcome, but like everybody goes into it with just that awareness at least, which, makes things a lot easier.
Right. Of course. Let's say you're king for a day. You get to design, today's training, and we purposely want to push this people, the person or group of people to failure. So that they can finally, figure out what, I don't know, how to improve, I guess, in whatever it is. How would you design a scenario kind of like that, where it's going to be super difficult. They're not going to know the answers. There's constantly going to be dilemmas. Like, how would you design that? Yeah. Just how would you design that?
Yeah. I mean, and if we're designing something like that, I think in my head, at least, we're talking about, more experienced individuals. This is, a higher level of learning. And, I think anytime you're designing something like this, and I try to impress this upon every student that I have when it comes to designing educational experiences, is I've got to know the outcomes of what I want them to have. Like that, whenever you're designing a lesson, an experience, a scenario, whatever, I've got to know, like, where do I want them to go? And so I think that's the most important thing. I think we're just overall kind of lazy about specific outcomes that we want, right? And sharing that with people and letting them know that's part of it. But, really, in designing that, based on outcomes, and then sort of knowing, how I'm going to debrief things, letting them know that. And then like in the middle there is like all the stuff, and, you can do whatever you want with the scenarios. And, I've always joked with like, new educators, like wilderness medicine and things like that, we could make up any ridiculous scenario, and these folks that don't know any better are going to think it's amazing. And we always want like more, better, more extreme, more blood, more screaming, things like that. And I think part of that, we're doing it for us. And so the bag of stuff that you have to deliver the information, that can be any bag of stuff. That's not honestly what's important. And, for me personally, I'm going to want to make sure that there are, skills that are going to go poorly. Your video, your like, Mac, video blade that you carry around, like that's going to die, and you're going to have the DL and, on a bright sunny day. But there's also going to be some interpersonal stuff that goes wrong in case somebody's got the tasks really licked, and there's going to be some interpersonal stuff. And then there's going to be, an environmental challenge, and like making sure if I want it to be that they are going to fail, need to make sure it's a lot of variety in how those failures take place. Which sounds weird, to like ensure that they're going to hit a roadblock somewhere. And to also make it feel organic. You can definitely like create a sim with somebody where like all of a sudden they get to their patient codes and it's like, oh, well, they were hyperkalemic, they had bilateral tension pneumos, they had a pericardial tamponade, a brain bleed, and they were in rhabdo. Like, of course, you're never going to fix that, but that's not realistic. It doesn't happen except on TV. And so making it feel organic and making it feel realistic to them of, oh, this is what it feels like to fail when X happens or when I encounter this. And it's, again, just like adding those little pieces that they can use to process in those moments. And then at the end of things, of course, like coming back to the outcomes of, I wanted you to realize that you can hit fail points and still move on and succeed in some way. Or you can hit a fail point and there's literally nothing you can do at that point. Like recognizing the difference between those two sort of like choke points or fail points.
Yeah.
That was kind of a rambling answer, but
No. So when you say you start off at, what outcomes you want to look at, right? Maybe let's make it a little more specific. Let's say we have a badly burned patient, greater than 20%. I guess, how would you start like pre-hospital? All right. So the answer is not take them into burn surgery, right? What we can do pre-hospitally, how would you start thinking about outcomes? So I think it's super important.
Yeah. And creating outcomes that aren't all about a task or about one thing, and they're going to cover the different possibilities I'm going to encounter. So, in that sort of scenario, I'm, creating an outcome or like establishing that when you get to that point, we're going to get to a point where you have to say, maybe like call a timeout, and then we discuss it in that moment of like, what's the dilemma right now? And so letting them know that like part of the outcome is going to be that like we're going to be stopping all along the way. And in the end, you see the progression of how you talked through all these things. But maybe the outcome is instead is intended for them to like go through the whole thing. I say no words to them, and that at the end, they are the one that processes back through all those different choke points or fail points. I think doing both ways or having like multiple ways to go about this is also important. And of course, this is, we're constrained by time and resources and money and things like that. Of how many times you can do this. I struggle to get a, instructor development course into, whatever we do, 16 hours. And, so there's only so much time to go around, but at least having a couple of clear things that they take away at the end, because kind of like that whole like deer in the headlights thing, we as educators, we want to share everything with them, because I want you to get all of this perfect. I want you to know all the information, and we're really only capable of taking in a few of those things at a time. What we do on the instructor development course and with other course programs that we do is a lot of people are writing down feedback, and you're eventually going to get those to, take home with you. But after the deliverable, there's only like 1 or 2 people that are actually giving you things, and they're limited to 1 minute so that it stays digestible. So that you're not getting feedback on 37 different outcomes, 25 you didn't even know were existed. And so I think the structure of how you revisit those outcomes is really important.
Yeah. What I try to do, and please tell me if I'm right or wrong, I try to limit it to like 3 things, like 3 outcomes. Let's say that kind of burn scenario. Okay, I want you to adequately provide some kind of analgesia and or sedation for the patient. I want you to get some kind of burn resuscitation fluid going, because I already know like this is more than 20%. He's going to need this. And I want you to make a educated, airway decision. Does the patient really need it or not? Right.
Mm-hmm.
And then I try to just limit it to 3 things that if you do or do not do these things, you will succeed or fail. And it's really based on that. Not, I don't like how you put him on the litter, or I don't like how you spoke to him, or I don't like, there's nothing like that. It's like, if you don't do these things, they will die. I don't know. What do you think about that?
Yeah. And I think, I don't know whether you did this intentionally or not, but, of the 3 things you just mentioned, the first one was very much like, I want you to make sure you do this task. And then with the airway, you said like, a very, thoughtful decision or well-run decision about what sort of airway protection treatment evaluation you're going to do. And that's almost like, okay, so this outcome, I just want to make sure you get this task and this specific thing right, versus this other outcome where like, I want you to go through a process and share that process with me so that we can talk about that, rather than necessarily like, I don't need to talk to you about the mechanics of intubating somebody, but telling me, the process of, I don't want to do it yet, and I want to use these medications, and I'm going to use this device, things like that, of being able to, just a higher order question of sorts. So,
but do you think
that was intentional?
Reasonable? Good job. Oh, hey, woo. But do you mix up your outcomes like that, or do you keep them very black and white, like you did it or you didn't do it?
No, because I mean, it's still, a concrete outcome of, I want you to come out of this with experience critiquing and reviewing your process. Like, one of the outcomes, I want you to be able to place, a chest tube, versus I want you to be able to reflect on a process that you went through. Like, those are still concrete things. One just is a lot simpler and like has a definite answer. The other doesn't have a definite answer. And I think that probably scares some people, especially early on, of like, I don't know how to answer this question. One of the great things about like wilderness and austere medicine is, you can answer pretty much every question with, it depends. And it's, it's a joke, but it's also very true. But, that objective is not going to have one answer. It's more about the experience, and just as powerful if there are other learners in the room that didn't go through it, but they hear somebody else's thought process and get some insight into just another way of thinking about things. We were talking about the styles of feedback, and, when you have the like very senior experienced instructor, giving feedback sort of like downhill, so to speak, can be very intimidating for a learner. And so, there's a place for well-structured and appropriate peer feedback. Because I think a lot of the times, like the big stuff that people are, missing or could work on, like other people notice that, they just didn't think to point it out, or they like are arriving at a point like, I don't really know what you were doing here, but just something felt off. And then the more experienced folks, we can be there to like help mold that into a more specific piece of feedback for them. But getting feedback from your peers is sometimes less threatening. Sometimes it's a waste of time, but you learn to maneuver around that.
Yeah. Yep. Cool. Well, Justin, any kind of final thoughts? Any major mistakes you see people do when they're starting teaching?
I'm guilty of this mistake as well, and I think a lot of people are. It's having the same like canned teaching points that you use over and over and over again. Like you're in the moment, you see something, and you're like, "Oh, I'll teach them about this right now." And I don't know. I think it's kind of lazy, and therefore I am guilty of being lazy in those moments. And sometimes I just don't have the mental energy to do anything else. I'm like, well, at least they will get something, as opposed to trying to teach, for the moment. And that can be in the moment, right? A new learner, it can be good to like intervene at the time because you don't want them to develop bad patterns. But then as a more experienced provider, learner, whatever, letting them kind of work through things. And this is another big one that I will point out that I think we don't recognize well, is the concept, I don't know if you heard of training scars.
Yeah,
so
I've heard
recognizing training scars are so important. The one that we joke about a lot with a group I work with in North Carolina called the Carolina Wilderness EMS Externship is the Scene Safety BSI, which everybody who's been through any sort of EMS education ever knows. You just like walk into a scenario, Scene Safety BSI, whatever. And so therefore it's not ingrained in anything realistic. And so as you become a more advanced learner, as you become a more advanced educator, really paying attention to those training scars. They seem like little things that become huge problems when you get into that like mystery and that unknown. And I think we're not good at, because we have a lot of the same ones too, because the education has been the way it's been for a long time. And like us doing these like small niche education experiences are not the norm, unfortunately. But I think we have a lot of the same scars, and therefore we don't recognize them in each other, and therefore we don't recognize when other people are picking them up because we think that they're normal. So I would say like address those training scars.
So one of the other, the BSI, Gina Safe, like I've heard that a couple times. Another one is like with chest trauma. They're looking for unilateral rise and fall of the chest. And I've seen that to be kind of a problem because they won't do anything until I have unilateral rise and fall of the chest, and trying to explain to somebody like, look at like this guy, he might be dead before you see that.
Yeah. Visible tracheal deviation,
Yeah, visible, yeah. His jugular veins are coming out of his ears. It's kind of a setup, I guess. Almost, I'm purposely not giving them that feedback.
Mm-hmm.
Am I just a jerk? Because I refuse to say unilateral rise and fall of the chest and release them to do the things they know to do.
Oh, I don't think that makes you a jerk. I think that makes you realistic. I think the jerky part would make it so that was the only sign or symptom that they ever had that would cause them to needle decompression.
Oh,
just to mess with you. It's one thing that you'll never see. That was the one thing that we put in there as the stop. It's like creating that unrealistic scenario that we were talking about before of like, nobody's going to present hemodynamically stable and then all of a sudden develop, unilateral chest rise and fall. Like that just doesn't happen. So, I think, so if you're intentionally doing it, then yeah, maybe you are a jerk, but I don't think you are.
No, I purposefully give them every sign and symptom other than that one.
Yeah, not the ones that actually happen. Yeah.
So, all right, good. Well, awesome. Well, thank you, Justin. I really appreciate you jumping on.
Absolutely, Dennis. It was a good time. I appreciate it.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. check out our free downloads and a ton of other helpful information, grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.